you have a truly ongoing educational program in place for your physicians? Are your nurse practitioners and physician's assistants being mentored for their success? How much better would your organization be if all your clinicians had access to regular, cutting-edge training on today's top healthcare issues? Beyond improving your organization, ongoing education is the key to unleashing the power of value-based healthcare. As a pioneer of such education myself, I can tell you firsthand, you must implement a systematic educational program if you want to provide your patients with effective, value-based healthcare. In particular, your clinicians need a thorough, comprehensive education when it comes to high-stakes areas such as risk code selection, documentation, and compliance. These are essential components of any value-based care system. So what are you doing right now to ensure that your clinicians understand these requirements and execute them well? If the answer is anything less than a systematic, organization-wide educational program, then it's time to transform your approach. Over the past 2 decades, I've helped scores of physicians, nurse practitioners, and physician's assistants achieve outstanding results through provider education programs. These programs are so much more than just an occasional mandatory video, group presentation, or informational pamphlet. They have to be. Healthcare today calls for an entirely different approach. Provider education must be performed one-on-one with each of your clinicians, receiving personalized training each month from a qualified mentor from within your organization. Your clinicians should also meet with their mentors and risk coders on a quarterly basis for productive feedback and powerful reinforcement of key ideas. Remember, the lower the educational level a clinician has, the more impact mentoring will have on them. Your nurse practitioners and physician's assistants will benefit tremendously from systematic mentoring, building their confidence, and filling in the gaps of their less intensive training. If your NPs and PAs are delivering primary care, then a robust network of mentors is absolutely mandatory for your organization to thrive. I've personally developed systematic educational programs for large medical practices, small groups, and individuals in all areas of healthcare. Let me design one specifically for you. Contact me and watch as your clinicians prosper and your performance soars.